Welcome to Thursday Thought Leaders with Harbinder Narula on BW Healthcare World. My guest today is Mr. Viren Shetty, who is the Executive Vice Chairman and Director of Narayana Health. Mr. Viren joined the Hospital Engineering Department of Narayana Health Limited in 2004 and was responsible for designing and commissioning the Mazumdar Shaw Cancer Center and the multi-speciality hospitals in Jaipur and Ahmedabad. He has also worked in the unit operations, supply chain management, business development, strategy, and investor relations for Narayana Health Group. Let's speak to Viren on how the vision is evolving at Narayana Health and to also talk about the change in branding and the outlook that it brings to the future of what Narayana Health could look like. Welcome to BW Healthcare World, Thursday Thought Leaders. Viren, let me begin with a question. You started your career in Narayana Health in 2004. Since 2004 and today, how, in your opinion, has the healthcare business evolved? How has the hospital and the role it plays in delivery of healthcare evolved in India in these many years?
Sure. In some ways, our business hasn't changed between 2004, maybe even 1904. The fundamentals of this business will always be the same. That is, a lot of people get sick. They need to get treated by doctors, and hospitals are a place where doctors are able to practice with all the equipment and support that we are able to provide them. So the fundamentals of this business haven't changed at all, but the things that have changed the most that I've noticed from the time I've been working here is number one, a growing awareness among the customer base that healthcare options are available to you, and it is safe, and it is affordable, and more important than any of that, which is still, I wouldn't say a solved problem, but something has to be done, that you can get treated for healthcare. When Dr. Shetty came back to Calcutta in the early 90s, most people, if they were told you have a heart condition, they would say, okay, fine, I guess I'm going to die now. Let me get my children married. Let me write my will, get all the things sorted, because clearly this is not something that can be fixed or cured. And the biggest challenge that Dr. Shetty had to overcome back then was convincing people that no, a solution is there. Whether it's an operation or a stent or a valve or whatever it is, that the procedure exists, we can do it, it is safe, and you have a much better quality of life after that. That mindset shift has been the biggest, and even post-COVID, it's become even more so because the range of procedures that people are getting treated for very advanced cancers, for things that we couldn't imagine were curable 10 years ago, the range of options have opened up that much more. So the biggest change we've seen is that customers are coming and saying that, see, we've done the research. We know you all are the best center for all these things that we have. And so we want you to take care of us.
That's a very beautiful change that I understand from not having an option or a thought of not having an option to be at a point where you can choose your treatment options and choose where to get that treatment. That's a very beautiful journey that has been. Wherein also Narayana hospitals, from the time it all began, the nomenclatures evolved as the center of excellences were being set up, as the institution was growing and evolving. What were some of the challenges that led to the need to relook at the branding of the institution today?
There's a long answer and there's a short answer. Which answer do you want?
Give me a long answer.
The long answer is the shift to health encompasses our ambition to be seen as something more than just a cardiac care provider. So that is, we are not doing a service to our patients if we're just taking care of one small spectrum of healthcare. Now, to be fair, cardiac care is the number one cause of disease for most Indians. It's half the chances that you will die of natural causes in India will be cardiac related. So it's still the largest focus area for us. But to say that we are entering into health is an indication that we want to look after the whole set, not just the cardiac surgery. It's a long answer. The short answer, even today, it's very difficult to pronounce Hridayalaya. So Narayana Health, it allows us to keep the name N and H, and Health, Hriday, sort of adjacent. So that was why we changed it.
Got it. So as I understand, one is the focus is moving from just being seen as a heart care institute to now being seen as a healthcare delivery institution. And also from the marketing perspective, it's difficult to pronounce. So you're moving to health rather than Hridale. Brilliant. Viren, is Narayana Health now the mother brand?
Well, Narayana will be the mother brand because we're branching out into many other health adjacent specialties. So we're starting clinics. We will have pharmacies. We've also applied to the IRDA for a health insurance license. So it'll all have health in some form or the other. We will still very much known as a healthcare brand, but there will be Narayana Hospital, there will be the Narayana Clinic. In Bangalore, we have the Narayana Health City. Fingers crossed, when we get our insurance license, it'll be called Narayana Health Insurance. So health will be there in one way or the other. And when you think of us, you have to think about healthcare, but there will be many brands associated.
And with this institution evolving to I would say that, from a hospital evolving to an institution today, what are your plans on reaching across the country rather than being limited to certain areas of the country?
Scaling has been the biggest challenge that we have faced. It is, if you define healthcare as being provided in very large, internationally accredited hospitals that are lakhs of square feet, that cost hundreds or thousands of crores to build in tier 1 locations, where you get the best talent who can work around the world and they choose to come work for you, and you fill it with the best machines from all the top multinational companies, and you do all the cutting edge clinical trials. If that is how you define healthcare to be delivered, then there are very few places in the country that you can build at, because a small town simply doesn't have the volume to sustain that kind of such a large hospital. A small town simply won't be able to attract all the doctors who want to stay in a tier 1 location. So if we want to scale, we have to change what it is about people expect when they come to a hospital or how healthcare is being delivered. And so we have to scale down our model and also scale down our ambitions. There was a time Dr. Shetty wanted to replicate the same hospital throughout the country. And we tried that. We spent the first 16 years of our journey just building one model of very large hospital. And we realized it can't scale very well because it's very expensive and you don't generate that much of a return. And it's very hard to scale that. So we have to scale that down. And so we built smaller hospitals, daycare focused hospitals. Now we're scaling down even lower into clinics and pharmacies. In the future, we'll scale down even more to not being in a hospital, just by offering care virtually, care on the phone. Now, it may not be the entire spectrum of care. It's very difficult to do 10 out of 10 things on the phone, but even out of 10 things can be quite well managed on the phone. So from the patient's perspective, we are taking care of the entire spectrum of care. So the name that we've given to this venture is called integrated care. So the company we created around this, all our clinics, pharmacies, labs, call center will be housed under this entity called Narayana Health Integrated Care. The idea being, for the surgery, for the time you need to see a doctor, if you're getting a chest cut open or some probe put in your mouth, the hospital will always be there. But everything outside of that, because you will go to a hospital only once, maybe twice in your life. Every other medical interaction you will have is either at home or on the computer when you're Googling something, or in the pharmacist, or you just ignore it. So a hospital doesn't even capture 1 out of 100 healthcare events that a person will have in their life. Major healthcare events. I'm not talking just about taking fever medicine. So if we want to play a part in our patients' lives, we have to downsize ourselves. And so that means the services like reminder for medication, or if someone needs help losing weight, or if they have problems with sleep apnea. Not all of these are hospitalizable events, but all of these, if unaddressed, will lead to a serious complication, which will cause you to come to a hospital and shell out lakhs and lakhs of rupees, which is unnecessary and avoidable. And because institutions like ours haven't been focused enough on this, is why there's a massive epidemic of non-communicable diseases, lifestyle diseases that is rampant throughout the population. So we are, as a country, getting richer, yes, but we're also getting sicker.
I think you've touched upon a very important aspect that technology is now making us move to a more efficient way of healthcare delivery, where only the really sick who need to be in the hospital come to the hospital. Everything else, thanks to technology and a hub and spoke model, can be managed at home. That's a brilliant way to go ahead. Viren, let me move towards back to the new entity, the new logo. You've not only changed the name to make it sound simpler, and to also use the word integrated to house everything related to healthcare under one mother brand. Why the change of colors? Is there a thought behind the color and the impact that you think is going to create on the business and its perception going ahead?
I'm not a marketing person, and we did a lot of the brand surveys, and people who can come and explain all the color psychology and the things that get into that. Those are words that are well beyond me. Essentially, why we changed this was to bring our brand back to its roots. The original logo that we had was a heart, followed by a cross. The heart was embedded inside a cross, but it wasn't a typical cross. It was 3 lines up and 3 lines to the side. And that stood for a lot of things. One is, red and blue lines stand for the arteries and veins of the human body. The other is, it was a bit of the heritage. So the company was started by my grandfather, and that logo was his company's logo. It also had some religious connotations as well. But anyway, so that blue and red and a heart was something we wanted to retain because that was important to us. That's part of our legacy. So in a way to do that in a more modern fashion was why we came up with that. But these are usually universal colors for healthcare. Globally, if you look, blue, red, sometimes green are colors most associated with hospitals and healthcare brands.
And, when you're talking of healthcare, the first thing that comes to our mind as a layman is hospital. And when you look at a hospital, the first thing that comes to our mind is the doctor and the surgeon, right? But there's much more that happens in a hospital. You look at nursing, the paramedical staff, the technicians, etc. And what is your opinion on how these services are evolving? Because as I understand, when I speak to people, is that we have always spoken about the shortage of doctors, but nobody's focusing on the shortage of nurses and trained nurses and being able to retain them. Because the moment they get trained, the moment they gain experience, they are, they move abroad for better jobs and better career opportunities. How do you think going forward, these challenges can be overcome?
See, one is the doctors and nurses leaving to go abroad is something we as a country have to celebrate and not bemoan. I'll tell you why. Because anyone choosing a profession, they look at what is the end goal of that. And every institution, like it would be nice as an employer, it would be nice if our employees were loyal to us forever and they would stick with us and they would never leave. But that's not a fact of life. People go where their ambitions and where the opportunity set takes them. So the more nurses and doctors that go abroad, the more attractive the nursing and healthcare field becomes, and more people start to come in. And that's something we welcome and celebrate. But it doesn't take away from the fact that this is a problem, which all hospitals have to face, which is huge amounts of attrition at the nursing level mostly, not so much at the doctor level, but at the nursing level. And so it just means you have to train a lot of manpower. And so a lot of our hospitals have nursing colleges attached. And even the nurses that we take, we put them through intensive training programs. And we do it with the full knowledge that we are training the workforce of the Western world. And that should be fine, because those nurses will one day grow up. They will want to move back. And when they come, ours will be the institution they remember. Or even if they don't ever come back, they will serve as the best case example, the girl who everyone aspires to be, and thus get more people into the nursing field.
Fantastic. I mean, that's a very fresh perspective to nursing that I have gained today. Uh, Wherein there have been a lot of conversations about the insurance business and how it can become better in the coming times. And when I met Dr. Shetty, he also mentioned that this could be a very beautiful, the operator-led insurance could be a very beautiful way to bridge the lack of trust between the ecosystem, which is the insurance, the hospital, and the patient themselves. What is Narayana Health's plans to launch the operator-led insurance anytime soon? What is your vision on this?
When we started out this organization, Dr. Shetty was very clear. We are going to change the paradigm on affordability because this is India. Everyone is paying out of pocket. Healthcare is very expensive. And so everything we did for the first 20 years of our journey was oriented around making our services more affordable, reducing the cost, reducing the flab, trying to do more with less from this sense of frugality that you have as an Indian organization trying to survive in India. But beyond a point, you reach this curve known as the curve of diminishing returns. We cannot pay our doctors any less because they will leave to other hospitals or they will go abroad for treatment. We want to pay them more. We cannot pay the nurses any less. We want to pay them more. We cannot compromise on the quality of medicines that we use. So we cannot use low quality, very low cost generic drugs from unlicensed, unregulated manufacturers. We use the best medicines. We don't want to compromise on the medical equipment we use. We don't want to compromise on the building. We have to comply with the 100 sets of statutory norms and regulations. So after doing all of that, then the scope for cost reduction has gone away. We haven't been able to cut our costs any further. The only things we're able to do is on the efficiency and throughput, which is at least for the fixed cost that we have for an MRI, you run it for more hours in a day. So we have to schedule people. But then still, you can't expect people to come in at 2 in the morning. Even if you do the MRI for free, it is inhuman to say that you should come for MRI at 2 in the morning. No patient will want to do it. No doctor also will want to work at that time. So we're constrained by the physical limitations. So that leaves the last frontier. And Dr. Shetty may mention this as well. The most expensive equipment in a hospital is the doctor's pen, because that is the thing that prescribes the surgery you need to have. So you can take a surgery that costs 4 lakh rupees and make it 2 lakh rupees, and you will still have a very unsatisfied customer, because unlike any other service or product that you buy, if you're waiting on the new iPhone, if you're planning for a vacation in Paris, you plan for it, so it is scheduled, you look forward to it, so it is anticipated, and you feel good after while you're getting it and after it is done. So it's scheduled, anticipate, and leaves you the feel good feeling. Nothing in our business is like that. Nobody plans to have a heart attack. It just happens to you. Nobody anticipates it. Nobody has said, okay, this is something, 2 lakh rupees, I have to keep that money aside on an EMI basis. Nobody plans on it. And nobody's happy. So none of our patients feel good about paying any amount of money. Even if we said it's 200 rupees instead of 2 lakh rupees, they will say, no, I never wanted to come here. How dare you ask me for any money? You should have not had me get the heart attack. And that's exactly why we built an insurance company around that, because we realized that if we have to get that behavior and get patients well before the time of heart attack, we don't wait till they come to the hospital. By the time they come to the hospital, it's too late. So what is the excuse that we have to call our customers beforehand to get all their medical information, to have a reason for them when we call that they pick up the phone? And all of those align very closely with running an insurance program where they're paying every month a premium. And since the services are provided in my hospital and partners, it is completely our incentive to keep them out of the hospital. Now, traditional health insurance company doesn't involve themselves that much from the services side because they're not in the services business. Our insurance program will be run services first, oriented around keeping them healthy, making sure their weight stays down, their cholesterol levels are low, they're on sort of medication, they are fit and healthy, and to keep them out of the hospital. Because when they go for a procedure, that is a loss to the insurance company. And the only way you prevent that is by keeping them healthy. So this will be the ultimate fulfillment of Dr. Shetty's vision of providing healthcare for all. And not just making cheap surgeries, but provide healthcare for everyone, especially when they're healthy, and prevent them from coming to the hospital.
So do you think that insurance companies are the best suited to invest in preventive healthcare? But that's how, I mean, if they're not spending money on hospitalization procedures, there's only time when they can make money.
Yeah. This is not difficult. The protocols to call someone and say that if your BMI is around 24, I want to bring it down to 20. These are the 10 things you need to do. Even a 12th standard student knows enough about diet, nutrition, and exercise to be able to give you the advice that will mirror closely what a PhD level person can do. So it's not a capability issue. Anyone can provide this. Insurance company can do it, government can do it, school can do it, employer can do it, doctor can do it, nutritionist can do it. Some random influencer on the internet can also do the same thing. Anyone can do this. But it ultimately boils down to the incentive. So there's this old saying, you show me the incentive, I'll predict the behavior. So if a person is incentivized enough to do it, and we as a provider are incentivized enough to keep them out of the hospital, you can be damn sure that we have more than anyone else have skin in the game. If you are offering this as a service, if you're just a nutritionist saying, do these 10 things, but I get paid no matter what, then there's no incentive for follow through. If you're a gym and you're offering memberships and you're paid once, and if you go, great. If you don't come, it doesn't matter. Or if you're a doctor, we will do everything that's possible for a doctor sitting in a hospital. We'll do everything that's possible for you while you are in the hospital. But outside of the hospital, we have no way to contact you. We have no way to know if you come for your 6-month follow-up. So we want to align the incentives. The patient is aligned because they are paying, instead of 2 lakh rupees, they're paying maybe 2,000 rupees. But they're paying it consistently.
Viren, my last question to you before I let you go is that you have Dr. Devi Shetty, who's been the front face of the institution for a very, very long time. And you, on the other hand, are a non-medical who's at the leadership team. What is your vision for Narayana Health integrated services for the future?
See, the most common experience most people have when they hear that someone they knew got a heart attack or diagnosed with stage 3 cancer or had some serious problem, they think, oh, so bad, so sudden, so young, shouldn't have happened. And you read this in the news, you read this in, and everyone is surprised by it. For those of us in the healthcare industry, death is not sudden. It doesn't just happen. There are enough and more warning signs. In my own family, my extended family, it is very well known. Most of the males are diabetic, very well known. A lot of them will have issues with their kidney, will grow up and have issues with Alzheimer's and so on, because we've seen it. Yet, with this level of awareness, none of us are doing anything proactive in our younger ages to get that treated. So the vision, if you want to say, like, what do we want to get it done? We want to get to a point where there is an all-in-one offering that, yes, the onus has to come from the self. That part we're in agreement with. But there is an institution that has built resources, all the resources aligned around helping patients and helping our customers live their best life. We could have been happy running hospitals, doing surgeries, and there's enough money in doing that. But if we're not taking care of our customers outside of the hospital, we're not taking care and make sure they don't come in the hospital, we're not a healthcare institution. So the vision for what we want to create, the shift in the direction towards being much more than a surgery provider to being a healthcare provider, is that we can do enough to create a mindset shift among Indians about being more proactive about health and giving them all the resources they need to, if they want to live to 100 and do marathons into the 80s, the science exists. The things we know you need to do are already there. But it has to be a joint effort. And we want to be part of that effort.
Viren, it's been a pleasure speaking to you, because what very clearly comes out is that predictability can lead to prevention. So just knowing it does not help you, but knowing what could happen to you can trigger off a lot of action that people could take. And understanding of perspective of how a hospital runs, when you were speaking about the various costs and the perspective to nursing and how we should be proud that our nurses are in demand, but what we need to do to help build this profession better and bigger is a responsibility that we need to work on. Thank you so much for taking our time to speak with BW Healthcare World. It's a pleasure speaking with you.
Thanks.